Today we are going to talk about one of the most busiest and misunderstood topics in plastic surgery, and this one is the corset surgery. It's a board-certified plastic surgeon who is going to explain to us what is this procedure. So what is the corset surgery?
Well, generally, corset surgery refers to a procedure that involves suturing the rectus abdominis muscles, which are muscles located in the front wall of the abdomen. Generally, it's a part of the abdominoplasty surgery, right? Because what happens? Well, the typical patients who come in for abdominoplasty are women in their 30s, late 30s, or 40s, who have already had their children and now want to restore their bodies. So, pregnancies have caused the rectus abdominis muscles to separate along the midline. This is called diastasis of the rectus muscles. So sometimes it's not that you're chubby, but rather that your abdominal wall is loose. So when I perform an abdominoplasty and go in through the lower part of the abdomen, I have the option to stitch the muscles together along the midline all the way down. All the muscles are stitched together, and you can see that this also improves the waistline. By stitching along the midline, I'm also going to improve the body contour because I enhance the waist and also leave the abdomen flatter. So that's what abdominoplasty requires. It's part of the abdominoplasty surgery. And at the end of the procedure, what you do is remove the excess skin from the lower part that was left over.
So what is the difference between the abdominoplasty or tummy tuck and the corset surgery? What is different?
Corset is part of the abdominoplasty in most cases. Of course, there are cases that aren't common. Let's say a patient who hasn't had children and just had a change in weight and has some excess skin. She probably doesn't need a corset because she doesn't have diastasis of the rectus abdominis muscles, but most patients who have had children do have it. So it's part of the abdominoplasty.